And hepatitis, in my opinion, it's kind of um, autoimmune diseases in general. You always have to fix the emperor. You always have to fix the imperial fire. It's something about, it's like the way the country is being ruled is off, right? And it's not being ruled by the emperor. It's probably ruled by other factions, but it's not really. There's a lot of infighting, almost as if it were, right? So I have never seen an autoimmune case where I didn't at some stage have to fix their yin conformations, and most specifically Shaoyin and Jueyin. You always have to end up fixing Shaoyin and Jueyin. Now, before you get there, of course, there's a journey, but you always have to fix Shaoyin and Jueyin. And so, autoimmune hepatitis, therefore, by extension, also ends up being ultimately the patient needs some type of aconite and Dangui combo treatment, right? A, just an acute kind of hepatitis, let's say hepatitis A or something like that. And I'm not even necessarily talking about the acute jaundice phase, but just the person who's had hepatitis A or a person who's got hep B or C, something like that, without the autoimmune component, their bodies are not necessarily as weak as the autoimmune patients' bodies. And so I don't think I have had to accompany each one of these patients into a Fudza stage. I don't think I have, actually. A lot of them, they come in where their liver enzymes are elevated and things like that, and then you mostly harmonize Shaoyang, and then they normalize. But then their pulses might not be as deficient as the autoimmune hepatitis patients' pulses, right? But so I would always say that if you're going to go from this perspective, people who have hepatitis, um, some of the symptoms that can occur are, for example, nausea, right? Aversion to oil, aversion to greasy foods, those kinds of things. They can have slight subcostal pain or flank pain, those kinds of symptoms. And going from those symptoms, of course, that puts a smack in a Shaoyang treatment, right? It's just straightforward Shaoyang treatment. And so first you would harmonize. If they are nauseous, you need the Xinjiang Bansha combo, right? Nausea, then, nausea, nausea. Then you end up mostly working with Xiao Cai Hu Tang or Da Cai Hu Tang, right? Because you need the Xinjiang Bansha if there's nausea in the picture. One thing that is kind of important to remember is that Chai Hu Gui Zhiganjiang Tang, which is a very important one, especially for the more chronic types. Chai Hu Gui Zhiganjiang Tang is quite cooling for the stomach because it has Tianhua Fen in it. And therefore, it's not a very powerful formula for nausea. Actually, it sometimes would even give people nausea because of the Muli and the Tianhua Fen combo being quite cooling for the stomach, right? So if nausea is pronounced, you're better off with Xiao Cai Hu Tang, Da Cai Hu Tang. I mean, of course, Chai Hu Gui Zhi Tang, but then there's like a surface component. That's not necessarily what we need here, right? But those two formulas would be the first ones to go off of, right? If you're looking at pain on the liver region, right? Then if there's pain with nausea, of course, you can do your modification, right? But the pain, you're going to use Muli as your main herb, right? The glomus stuck feeling under the ribs, that's Muli as your main herb. So then either you do the Xiao Cai Hu Tang, Da Cai Hu Tang mod, which would be for pain, would be minus Da Zao plus Muli, right? Or you just go straight up Chai Hu Gui to Ganjiang Tang. Ganjiang Tang or Chai Hu Jia Longu Muli Tang. Because then, of course, you've got the Muli in those two formulas, right? So that's kind of that. Yeah, that's about. I think probably you'd be looking at something like that to start with, right? And most patients, their liver enzymes return to normal over the course of a few months of being on a Chai Hu formula. That's mostly what I've seen. If they are truly in that yang conformation. Now, if they are not in a yang conformation, let's say they're in a yin conformation, Dangui or Tai Yin or something like that, Dangui Jianzong or Shao Jianzong, if they're in that stage and you give them Chai Hu, that's actually when their liver enzymes might get worse. Or best case scenario where nothing happens, they don't change, right? Because to be able to work with a yang conformation formula, you have to have enough yang in the body. So if you don't have enough yang in the body, if it's a yin conformation pattern, and you give a yang conformation formula, it's not going to work, right? So people tell me, yeah, I've given Chaihu, but it didn't change. Well, were they truly a Chaihu pattern? How well did you read that, right? Maybe you didn't read that perfectly, right? But I would say that these formulas would be the first formulas to consider if it is indeed a yang conformation pattern, right? You're not going to really see anything in Taiyang. And if you see anything in Yangming, you have to fix Yangming first by itself anyway. If it's concurrent Yangming, Da Caihu is here, so that kind of fixes Yangming also. So that's what you'll start out with. If it has been more chronic, you're more likely to go towards Chaihu Gui Ganjiangtang. The nausea tends to kind of wear off after a long period of time. So if it's gotten more chronic, they've had it for a few years, right? Then there's more hardness, there's more risk of the liver kind of having more cirrhosis and things like that. So it's been a longer process. Then you might have to go to more of the Muli formulas to begin with. So the Chaihu Gui Ganjiangtang would be my favorite formula then, right? And Dr. Zheng, my teacher, because in China there's very high incidence of hepatitis, so of course he would see that very often in clinic, right? Whenever he treated hepatitis, he always incorporated a little bit of blood movement, right? Because the liver is, of course, it's what we call the hard organ, right? The liver is the gangzang, the hard organ. Where the Chinese were aware of the fact that the liver, over longer periods of time, can suffer the pathology of hardening, right? And so Muli is very important for softening, right? And if there is indeed a lot of subcostal pain, you can go 12 to 24 grams on the Muli, no problem, right? And so that's in charge of softening. But then also blood stasis is another risk for the liver, because the liver is the organ that stores the blood. And so if the liver gets harder and more stuck and more inflamed, and imagine this, it's kind of like the same pattern as heat entering the blood chamber, right? Heat entering the blood chamber, we talk about how the ministerial fire is flaring, and it actually is negatively affecting the blood of the patient. Now, heat entering the blood chamber is talking about the blood in the uterus, blood in the womb, and it causes clotting, and it causes like bleeding changes in the pattern of the bleeding, right? But it's kind of the same thing here. When the ministerial fire flares, Shaoyang is contained within Jueyin, and what's going to happen is that the blood is going to warm up from the inside out, right? So it creates stagnation, it creates the drying out of the liver blood and those kinds of patterns, right? So that's why you end up with blood stasis. If the liver is kind of inflamed for longer periods of time, you end up with blood stasis, right? So then my teacher, Dr. Zheng, would always start to incorporate some blood stasis. Now he did Taoren and Honghua, right? Dr. Zheng would do Taoren and Honghua, and there's absolutely nothing wrong with that. It is very effective because, of course, as we talked about in the past, also, right, when you're looking at blood movement, this side of the body, so the patient's right side of the body, right, is for pungent blood movement, right? And this side of the body, the patient's left side of the body, is for bitter blood movement, right? So then we, in Zhangdongjing system, I use Taoren plus Mudanpi, which is pungent and cool, right? So that's going on the right side of the body. Dr. Zheng, he used Taoren and Honghua, which is pungent but a little bit warmer, right? But it's still on this side of the body. So the goal is that you have indeed pungent, right, on this side, and then of course a bitter to get rid of the stagnant blood from the other side. So whether you do Taoren Honghua, it's absolutely fine, or Taoren Mudanpi, it's absolutely fine. I just like doing Taoren Mudanpi. Right? The only thing you could say is that when you're already having a formula, let's say you have Chaihu Gui Ganjiangtang, right? You already have Huangqin in here, right? And then I have to do another Mudanpi on top of that. That gets a bit cooling. So if there is indeed a lot of heat, right? There's no problem. I have no problems adding Mudanpi to a formula with Huangqin in it already. But if it's a bit more chronic and there's less heat, right, then maybe adding Mudanpi to Huangqin could become a bit too cooling. And we also don't want to create cold liver, right? So then the way to get around that might be to indeed, like Dr. Zheng did, do Tao Ren Honghua, or do the minus Huangqin plus Mudanpi modification, right? So then you could say minus Huangqin, right, plus Tao Ren Mudanpi Baishao, right? So that would be the other way to get around it. So if you don't want to do Huangqin and Mudanpi combo, you can do minus Huangqin plus Tao Ren Mudanpi Baishao, especially when people are more weak. When you have a Shaoyang pulses have such a huge range, right? You can have quite excessive and strong Shaoyang pulses, but then you can also have like really weak but still Shaoyang pulses, right? So you can have a huge range if the person's pulses are really weak, or if their right hand pulses are getting quite big, right? Which tells you that they're quite taxed, that their body's resources are quite taxed. Then you want to start considering to not go too hard with the Huangqin and start incorporating either just the Baishao or Baishao Mudanpi instead of the Huangqin, right? Because if the blood is weak, if the patient's blood is weak, you have to somehow have some Baishao to protect the blood, and then using Mudanpi. Kind of like when a woman is having her period, if you do too much Huangqin, because the blood is leaving the body, so the body's not as hot, right? It actually would cause cold cramping and cold contraction, right? So you don't want to do that. That's why we use Baishao Mudanpi as a substitute, right? So it's kind of the same principle. Now, not for cramping or menstrual issues, but just because the blood is weak, you don't want to weaken the patient any further, right? Cai Ganjiang, Muli is pretty low in this, so you can go higher on the Muli, right? And then you incorporate Tao Ren Mudanpi Baishao. If you're doing that, most likely, I will also have the Fuling in here, which basically means I combine it with Guizhi Fuling Wan. Right? And that's actually where you most commonly will start. That's where you most commonly start. Chai Hu Guizhi Ganjiang plus minus Huangqin plus Guizhi Fuling Wan. In the beginning, I might choose to, for like 4 weeks to 8 weeks, I might not use the blood moving yet, and just work with my standard Chai Hu Guizhi Ganjiang, with Huangqin, to really make sure that there's no heat affecting the liver. So I really clear the fire of the wood. Then I switch it to taking the Huangqin out. Guizhi Fuling Wan goes in. I start working more on the blood stasis. I start using more Mudanpi instead of Huangqin, and then take that for another few weeks. And you'll see the numbers slowly regulate and come back down to normal. Right? But then, of course, and that's the easy part. That's the easy part. Bringing the numbers down is the easy part. But then the next stage is like, how do you follow up with that? Like, how do you keep capitalizing on this result and follow up with that? And that's when it gets a little bit more involved, right? So, you guys got this? I'll erase this. Next up, then, so this was more the acute stage to medium length, medium duration, and now we're going to start doing more follow-up, right? Follow-up, or for a lot more acute, more deficient, a lot more chronic and deficient. So then, to get out of that Chai Hu Tang phase, there's a few possibilities, right? If the person truly had a lot of nausea and truly had a lot of digestive discomfort, and that happens a lot with hepatitis A, where it came because of oral fecal, dirty food, bad food, that kind of stuff, it is possible that one pathway actually took you from Xiao Cai Hu Tang modified or Ta Cai Hu Tang, right, into a Xie Xin Tang, right? Most likely Ban Xia Xie Xin Tang or something like that. That is possible. That pathway does exist. It's not super common. In China, maybe a bit more common. You have people with intensely thick tongue coats and very turbid urination and things like that. And then, of course, you have to add herbs like yin chen hao and things like that, right? That's different, but not so common here. Here, we're going to come out of, for example, our chai hu gui zhi ganjiang tang, and then we need to bring it to somewhere else, right? So then normally I would say that you're probably best to go through a sinisan. Take it through sinisan. So then you probably will follow up with sinisan. Sinisan, by the way, for the record, being the best formula for ascites. Right? Sinisan is the most important formula that we in our system use for ascites. Right? Let's say a person has liver cirrhosis or liver cancer and has a lot of fluid buildup. Right? You can't leach out those fluids. You have to get rid of those fluids through the triple warmer, through the interstitials, pulling them into the digestive system and getting them out that way. Sinisan promotes urination by smoothing the qi flow. Sinisan promotes defecation by smoothing the qi flow, right? So it's the most powerful formula to get rid of all the turbidity of that accumulates in the abdomen. Now, sinisan alone is as the base formula, right? You will build on top of that. My teacher, Dr. Zheng, liked doing sinisan plus pingwei-san. But then pingwei-san is, it's not a Zhangdongjing formula. But pingwei, that's you have to put that in the context of Sichuan, right? This extremely damp climate and extreme damp-inducing foods, right? So people have like the thick, greasy tongue coats that you cannot imagine, right? So of course he would do a lot of sinisan plus pingwei-san, sinisan plus kind of urchin kind of principle, right? So all of those exist in Dr. Zheng's way of treating that. I would say that, and he adds shebai to it and things like that. If there truly is ascites, lots of ascites, I would say sinisan plus jishi shebai guizhitang is also very effective. Guizhitang, right? Plus bansha. Sometimes even xiao bansha jia fuling tang, like going high bansha, high shengjiang, that kind of stuff. Like those kinds of combinations are very powerful for ascites. Because the liquid that accumulates in the abdomen is extremely turbid, right? If you've ever seen those kind of, like when they do a puncture and they draw some of the fluid out, it's extremely turbid. It's like thicker and darker color and very impure. So there's nothing that you couldn't get rid of that through the urinary system. But that's not stuff that can go out through the urinary system, right? So you have to get it out through the digestive system. So that would be kind of like a way to treat the ascites. Now, let's say there is no ascites, you still want to get out of the sha cai hu tangs and stuff like that through a sinisan. The thing is, if you go too fast to a jianzhong tang, the liver enzymes might come back up. So you shouldn't be too fast with the treatment, right? If you go too fast from xiao cai hu gui zi ganjiang into a xiao jianzhong dang gui jianzhong, then sometimes you actually see the patient kind of their numbers kind of go back up, or at least the decrease in the numbers stagnates, and so then you want to take it a little bit slower, and taking it slower is done by using sinisan. Again, same principle. If there's flank pain, sinisan plus muli, right? Blood stasis consideration, sinisan plus guizhi fuling one, right? Those are kind of the things that you will use to keep that under control. The active inflammatory stage must be over to go to sinisan, right? You're starting to move into a yin conformation. There's no real active heat and things like that at this moment anymore. Otherwise, you have to stick with a Huangqin formula. But still, if you've got guizhi fuling one and sinisan combined, you have the baishao mudanpi, which kind of fulfills the function of a Huangqin anyway, right? So you're fine there. You're definitely fine. So sinisan plus muli plus guizhi fuling one is kind of the stage after the chai hu guizhi ganjiang tang stage, right? You've got guizhi fuling for the water. You've got muli, right, for the softness and also helps with the water, right? Sinisan opens the digestive system, opens the bowel movements, opens urination, so you get rid of impurities, right? It keeps coursing the gallbladder and the liver so that it doesn't get stuck anymore. So that's a really nice formula for that. And after that is when you have to start going into the yin conformations, right? So there's two possibilities here. There's two possibilities. One maybe slightly more benign would be that you go towards a Dangui Jianzhong Tang. Right? When you go to a Dangui Jianzhong Tang, you still have to have coursing of the liver. You still need some coursing of the liver. So there you also have two options. You either do Dangui Jianzhong Tang plus Sinisan. It's not something I like to do. I think, Michael, we were talking about that yesterday, right? It's kind of like a Xiaoyao San, right? Chaihu Dangui combo. Zhang Dongjing tends to not do that. Zhang Dongjing basically finishes all his Chaihu work and then starts his Dangui work. Like, he doesn't do it at the same time. But sometimes, if patients only come in sporadically, and you're gonna have to somehow project, 4, 5 weeks, 6 weeks ahead. You don't know, how they'll be in 5 weeks. Sometimes combining the two, as you're starting to build them up in Taiyin and Jueyin, right? You are preventing the gallbladder from getting stuck again, because when the gallbladder gets stuck, the gallbladder fire will flare again. When the gallbladder fire flares again, the liver blood is gonna heat up, and the enzymes are gonna go up again. The liver function test is gonna go off the chart again. So you want to prevent that. So one option is going Dangui Jianzhong plus Sinisan. What I prefer more is to go Dangui Jianzhong plus Chuanxiong. That I prefer more. So basically what it means is that we're going to look at Chaihu over here, right? And Dangui over here, right? So Chaihu is right here, and Dangui is down there as far as Shaoyang and Jueyin are concerned. And then we're going to position Chuanqiong nicely in the middle. Chuanqiong kind of treats nicely in the middle of these two, right? I mean, you can even put it like this also. You can say Chaihu, Huangqin, Zhishi, Chuanqiong, Dangui. You can also put it like this as far as coursing and clearing and getting deeper, deeper, and deeper. Does that make sense? So Chaihu Huangqin, Zhishi is like Huangqin, but it has the descending quality, the bitterness, but it doesn't have the cooling effect. Then the Chuanqiong is like a Chaihu, but what Chaihu does to the gallbladder, Chuanqiong does to the liver, right? Because it's pungent, right? And then Dangui is more nourishing for the liver. So kind of like this. This is kind of the sequence that you want to go through, like this, right? So then Dangui Jianzhong plus Chuanqiong, and then you can go your Chuanqiong 15 to 24, no problem, to prevent stagnation of the liver. Because if Jueyin stagnates, Shaoyang's going to flare, right? Because Jueyin is the Zhongqi of Shaoyang. So if Jueyin stagnates, Shaoyang is going to flare. If there's a little bit of risk of the digestive system still stagnating because you're just coming out of a Sinisan, you can also keep Zhishi in here, right? Keep Zhishi. What will be the maximum dose you could ever put Zhishi at in Xiao Jianzhong Tang? Up to the Baishao dose, right? But you'll rarely have to go that high. So normally I'm going to say 9, but you could go to 18 if necessary, right? And then if you want, you can still keep some muli in here, but it's not really that huge anymore at this stage, right? Dangui Jianzhong goes plus Chuanqiong or Dangui Jianzhong with Sinisan combo. And you might be on this for a while. That's one type of patient, right? There's another type of patient, which is a bit more the colder patient, the damper patient, the wetter patient, and also the autoimmune patient. And that patient is going to go Sinisan plus Fuzi. And not just Sinisan plus Fuzi, I'm going to say Sinisan plus Dinwutang. So this is the patient who had more fluids, more tendency to the ascites, more yang deficiency, right? So because you can do Sinisan plus Fuzi, that's why you can do Sinisan plus Dinwutang as well, right? So we're keeping the motion of the gallbladder going, but we're already starting to build the yang of the fire element so as to also dry out the earth element, right? So that's the next type of patient, and that patient is a bit more damp. If you compare the Dangui Jianzhong with this one, right? The Dangui Jianzhong patient is a bit more dry. This patient is a bit more damp, right? So you go Sinisan plus Jinwutang, and the same thing. You can keep muli in here if necessary, right? You can keep the muli in here if it is necessary. You can keep the Guizhi Fuling one in here, right? No problem. And then those patients will be on this formula for a while, right? And then you have to get this patient, him or her, get this patient, I'm going to erase this. You have to get this patient also off the Sunisan. After a while, you have to get this one also off the Sunisan, right? So then from this stage, off of the Sunisan, you're going to have to bring them to a Chuanxiong or Dangui Chuanxiong combo, right? So then the formula becomes very likely Dangui Shaya-san plus Jinwutang or Dangui Shaya-san plus Fuzi, right? Because you already have most of those herbs in there. You've got Baiju Fuling and Baishao already in there. You have to add Fuzi and you have to add Shengjiang, right? So then you go Dangui Shaya plus Jinwu plus Fuzi, right? So keep coursing, keep moving. You're no longer using the Chuancheng anymore. At this stage, you might not really need much Muli anymore either, right? So maybe not so much Muli. Some patients, potentially, you still need some Guizhi Fuling one. But that gets pretty strong moving then. Then it's really pretty strong movement for the blood. But it is possible. The Muli is not so common anymore at this stage, right? So then, Dangui Shaya plus Denwu, Guizhi Fuling one if necessary. Right? And then they'll be on that for a while. Right? And normally at this point, ever since this point here, right, their enzymes should be fine. Or maybe just a few points removed from normal. Like you don't want to jump here if those are not really regulated yet. Right? This will keep dropping them down to a very normal range. Once they're here, they stay normal. Throughout this whole thing, they should all stay normal. Right? So Dangui Shaya plus Denwu, right? And then there's a possibility of the following. Either, so this patient is going to start drying out, right? This patient will, because you're treating the water. So they'll start drying out. After they dry out, they either go to this here, they go to Dangui Genzo, which means they need less Baishao, everything is a lot milder. So they either go to this one, Dangui Genzong strategy, that's, if they've dried out, or, that's option A, or option B, they become more Dangui Sinitang, right? And at this stage, I would say Dr. Tian style, right? Dangui Sinitang plus Honghua. Dr. Tian uses Honghua. The only place I've seen him use Honghua in the writings is on a Dangui Sinitang. Dangui Sinitang plus Honghua. And you can also add one other herb or two other herbs, depending if you want to, would be plus Bieja or Bieja Shengma. Right? Because Bieja also softens the blood, softens hardness, right? Gets rid of blood stasis. And Shengma basically clears toxicity inside the blood. So the Bieja Shengma combination is going to take care of, the hepatitis virus, right? That is still a blood-borne pathology, right? So then you kind of start chasing the actual virus inside the blood, right? The only other option would be that you just go to Shengma Bieja Tang, the actual Shengma Bieja Tang formula. But I actually have never gotten a hepatitis patient that far. Because we're talking, this is now, by the time you get them on Dangui Sinitang, it's over a year of work. Especially with the autoimmune ones. It takes a while to get to that stage because you're going through all these motions, right? Step by step, ooh, baby, And so you have to slowly work them up to that. And if you don't, then, you might have to go back to a chai hu. And then in the meantime, they catch a cold, boom, back to chai hu, right? As soon as they catch a cold, back to chai hu. There you go. And then you have to bring it back down. Now, ultimately, bringing it down, it gets a lot faster and a lot easier after you've done it a few times, right? They get a cold, you harmonize, and then you're back on track. It's not a problem. But still, it takes a long time. So, Dangui Sini plus Honghua and Bieja is kind of an ultimate strategy, but that's when the blood is rather warm. Otherwise, if the blood is not per se that warm, that would be Shengma Bieja Chu Xionghuang Shu Jiao Tang. Right? So Shengma Bieja Tang minus the Sichuan pepper and minus the realgar, right? Because we don't have the realgar anyway. So that would be the other way of doing that, just having this formula instead of this one. So depending on whether the patient is a bit more cold or a bit less cold. Yeah, you might not need to do Dangui Sini. Yeah. I mean, I have done, but not for hepatitis virus. I've done for herpes virus. I've gotten the patient to Dangui Genzong plus Sengma Bieja. Right? That's also possible. And that's also a patient who's not as cold. So that would be another possibility. Maybe I'll write that down. Dangui Genzong plus Sengma Bieja. That's another one. And of course, people who, I mean, if once you start to understand how the bieja comes into play, you kind of start to realize the relationship to malaria, how hepatitis actually fits the ancient label of malaria, right? Because, you know, chills and fever, wiry pulses, leads to hardening of the liver, ultimately leads to the mother of malaria, which is like tumors on the liver, right? Bieja Gen 1, right? So then, of course, if it is a liver cancer, those kind of things, you would be talking about Bieja Gen 1 as far as the treatment, you see? So that's kind of what we're looking at. So, yeah. So that's the treatment of the hepatitis, the liver in sequence, right? Now, there's also complications, right? And of course, the primary complications would be maybe that a person becomes jaundiced. And then based on that, of course, then you just use the jaundice formulas, right? Then you would use the formulas of the jaundice system or the jaundice chapter. Do you have all this? Yeah? So when you're then, I'm going to erase all this, okay? You got it? Okay. When treating the jaundice, especially in relation to the liver, I would say that most commonly, I mean, Hep A, jaundice, I think, okay, Yinshen Haotang can come into play. Yinshen Haotang, all right, hepatitis A, just to fix the jaundice aspect, right, to get the jaundice to go away, that could be a good candidate for Yinshen Haotang. But otherwise, I don't see a whole lot of places where you would be using Yinshen Haotang. You know, I think a lot of times when you're treating jaundice, especially if the patient is hot and has a bit of a feverish aspect going on, like is there fever going on, and they're really hot and a little bit clammy, sweaty, I tend to just go straight to Taohe Chenqitang. Because then you just really very swiftly, very rapidly cool off the blood. This is rapid blood cooling, right? Taohe Chenqitang. Right? So Taohe Chenqitang, rapid blood cooling, right? Boom. Taohe Chenqitang has a standard follow-up formula per the Tian system, which is Zhi Bai Pitang. Right? Zhi Bai Pitang, Zhi Huang Bai, and Gancao. And then Dr. Tian often puts Hua Shi in this. So you do a few days of Taohe Chenqitang. How many days I know? Trust me, you don't have to worry about it. The patient will tell you how many days, you know, because it gives you loose stool, and after a while they're like, I think I'm done with this, you know. So, Zhi Bai Pitang plus Hua Shi. First you flush the blood, then you flush the rest of the liquids. Right? So that's kind of the normal way of doing this. After this, if you did go really acutely jaundiced because of your hepatitis, you go back to so this is the jaundice treatment, but then you'll go back to your hepatitis treatment. So normally with this, you can fix the jaundice, right? Now I know there's other formulas too. Ma Huang Lian Cha Zhi Sha Dou Tang and the Shahanlin, you won't really see that in hepatitis cases. I've never seen it with hepatitis cases. Dang Da Huang Xiao Shi Tang, okay, that's a possibility, but I haven't really used that one. It's the, I'm not really sure exactly. It's the Da Huang Mang Xia Huang Bai one. Normally more heat in the abdomen, more fullness in the abdomen. So that might be a possibility that you use Da Huang Xiao Shi Tang, but I haven't figured out exactly the parameter when to use that one and when not to use Ta He Chin Chi Tang. I'm not really clear on that. Ta He Chin Chi Tang, that's also kind of how Dr. Tian used to use it more often. I'm sure he used Da Huang Xiao Shi Tang, I just have no record of him, well, like any cases of him doing that. Zhi Bai Pi Tang. Zhi Bai Pi Tang is, it's a jaundice formula for some fever. It just mostly flushes the urine. It's a formula that basically flushes the hot urine, the turbid urine. And so it's also not really something that you would use exclusively by itself when you have an event of an inflammation of the liver, right? So, but as a follow-up to the Ta He Chin Chi Tang, that's how we would use Zhi Bai Pi Tang, right? Zhi Bai Pi Tang by itself is mostly used for just kind of lower burner damp heat kind of stuff, right? And often used for like gout. That's like one of my favorite gout formulas. It works really, really nicely when a person has a case of gout. Feet are swollen, red, joints are hurting, and that on the feet, those kind of they're a little bit hot, clammy, sticky sweat, and they're a little bit vexed and things like that. That typical gout case, Zhi Bai Pi Tang works really well for that. In the acute stage, it's more of an acute thing. The alcohol jaundice formula is just for that, and it's an acute jaundice due to overconsumption of alcohol, right? And then that's Zhi Da Huang Tang, right? So that one also works. But I would still say, if we're just looking at hepatitis and jaundice, I think hepatitis A, Yin Chen Hao Tang, flush the heat, then treat the liver. The other jaundices, especially if there's more fever and the blood is heating up, Ta He Chin Chi Tang. After a few days of Ta He Chin Chi Tang, you flushed it, and then you do bulk on. At that point, do bulk. Don't just mess with the granules. It's serious enough of a condition to not waste any time. Then go to Zhi Bai Pi Tang to cool off the fluid layer, and then you go back to treating the actual liver, the actual hepatitis. And so, doing that is done with the strategy that we just talked about. Now, most likely, you'll start with Da Cai Hu Tang then. You're not going to go straight to Xiao Cai Hu Tang. You're going to start with Da Cai Hu Tang, right? Because you've come out of this, you're going to go into Da Cai Hu Tang, right? Same thing here. You've come out of this. Those are all formulas that have Da Huang in it. So you might best start with Da Cai Hu Tang, just to make sure that the Yangming doesn't close off, just to make sure that the heat keeps descending, just to make sure that things keep eliminating, right? You don't want to like too soon go to Xiao Cai Hu Tang, which is milder, right? Less moving. Worst case scenario, if a patient just really can't take any more Da Huang, then you go to Da Cai Hu Tang minus the Da Huang, right? But then you increase the Zhi Shi. Right? Then you just increase the Zhi Shi. Increase Zhi Shi Bai Xiao. Sometimes you do Da Cai Hu Tang plus Sinisan combo. And when you do plus Sinisan combo, basically what you're doing is you plus Bai Xiao at 15 and then plus Zhi Shi at 15. Right? Just so that things keep moving. Right? You want to make sure that you keep getting rid of all the chemicals that otherwise would stagnate and cause the jaundice. Right? And then after this, then you're back at where we started with the previous sequence that we talked about, right? The Xiao Cai Hu, the Cai Hu with Ganjiang, etc., like that. There's one other formula. If a patient were to be chronically jaundiced, more chronically jaundiced, and it's, then at one point they might have had a Ta He Chin Chi Tang type of jaundice where the blood was hot, but now the blood is really hard and dry, and they probably will have already some cirrhosis, but they have no fever, no intense heat, no, it's just a bit like an ashen complexion, not necessarily like bright orangey yellow. Then, of course, you would have to use Didang Tang. But again, I haven't treated a hepatitis case with Didang Tang yet. I know of the possibility. Didang Tang, according to the Shanghai, treats jaundice, right? but it's more of a dry blood stagnation kind of jaundice. Know that the possibility exists. I haven't seen it yet. But again, I don't live in jaundice capital USA either. I used to live in China capital USA in Hubei. It's crazy that I never got jaundice just because there was the National Jaundice Research Center was right outside the food stall where I would eat every day. I'm just lucky that I never got sick. My Chinese language teacher, he was a Chinese medical doctor, professor at the school, but somehow they appointed him to be my language teacher. Poor guy. I think he liked it, but he was more of a medicine professional, not a language teacher. So, but anyway, he knew the tiniest bit of English, so that's why he was appointed. But he was a specialist in liver diseases, and especially Chinese medicine specialist in liver diseases. And he also was the chief editor of one of the medical journals in China. I think it's the Chinese Western Integrative Medicine Journal for liver diseases or something like that. There literally are thousands of journal publications in China, So, but he was a very smart guy, though. Don't get me wrong. This is, there's a lot of people who would love to be editors on those things. So it's you have to be really good to be doing that. But anyway, so the research institute where his office was right next to the gate of the college, and that's where all the food stalls were. So we used to eat there every day. So. And the hospital was right across the street, so I could have gotten sick a million times. I do think that they did once give me a shot, like a vaccination. I think a hepatitis B shot. I think if that's possible. I think that's possible. Right?
Yes.
B. Yeah, I think I got a hepatitis B vaccination at some point before going into clinic or interning or something like that. I think it was like, I don't recall exactly. You had to do 3 shots, like 1, 2, and 3, something like that. I don't know. Pardon?
B is a lot worse than A.
Right.
And
C is worse also, right?
C is
even worse, right?
But I had A. You feel pretty horrible.
Yeah, absolutely. But it doesn't. A doesn't stay with you for the rest of your life, right? A is like you're done. You're done.
Yeah, you're done. And it was it's alarming the color.
Mm-hmm. Yeah, I had a blocked gallbladder once. I had a polyp in my gallbladder. I guess maybe a lot of people have gallbladder polyps. Who knows? A little polyp in my gallbladder. I didn't know about it, but then I was traveling through Tibet, and there was I might have told you that. There was we had no meat and no vegetables, and all we could buy was potatoes, onions, and pig fat, like lard, And so we were stir frying those 3 ingredients for a whole month, every meal. And so, oh man, just thinking about it gives me hepatitis. And I think somehow with too much of the fat, it just inflamed my gallbladder or something like that. And then the polyp got stuck in the bile duct or something. And oh my God, I was dying. I thought I was, because it's my urine was, I thought I had blood in my urine. I thought it was blood when I looked at it. But it wasn't. It's just bilirubin, but it's just so red and so dark. Oh, I was freezing cold. I don't think I've ever felt that cold, which is, just intense shivering and chills. I remember we were staying in long story. We were kind of squatting in an abandoned house, but anyway, it was an old building that we were trying to the Tibetan Lama I was with, who was a Tibetan medicine doctor, wanted to start a little hospital in it, but the place was vacant, and so the only room that didn't have a leaking roof, we kind of squatted there, and then as we were petitioning the local county for them to kind of give the building to him to use it. Anyway, it was cold, it was miserable. But then, all the blankets we had, all piled up on me. I was on a little mattress, and they put all the blankets on me, 7 or 8 thick blankets, and I was still freezing cold. So, you had, severe shivering and chills. But we didn't have medicine. That's when I took the Tibetan medicine, which actually pulled me through. That's the Shagao story. Remember Shagao's pungent story? where I inhaled the shigao powder. Didn't I tell you that story? Yeah. I snorted the shigao. So, like in the Bensao Jing, we talk about shigao is pungent, right? But actually, when you boil it, it's absolutely bland. That's why some books actually mention shigao as having a sweet flavor or bland flavor. And then my experience with it being pungent was that because the Tibetans they don't boil their herbs. They mostly grind it into a powder because boiling water at altitude is difficult, and finding water at altitude is difficult, and finding wood to make a fire is difficult. So too many difficulties. So their medicine is mostly pills or powders, and so they grind the shigao. And the formula that the guy gave me had shigao in it. The Tibetan doctor gave me a formula, and so they basically that's what they do. They just put a few scoops in your hand like this, and you lick it off your hand, and then you drink some water, and you lick it and you drink some water like that. It's very interesting to lick your hand after not showering for 6 months, but that's a different story also. And so it's like all kinds of like, oh yeah, my meal from 2 weeks ago. So I was about to lick my hand, and I inhaled as I was about to lick, and I just inhaled all this gypsum powder, like in my nose and in my mouth, in my throat, and just like got stuck there, and it was so prickly and pungent, and I was like coughing. I thought I was gonna die because I just inhaled a bunch of dust, basically. So that's always my story. Like, yeah, I can see how they could call shigao pungent. It's very pungent if you inhale it. So. That was all around at the same time. Yeah, I had a big fever. Yeah, I was pretty sick. But the Tibetan medicine did pull me through. But yeah, they do urine analysis. Like one of their diagnostic tools is they look at urine, right? The Tibetan medicine doctors, and so that's why I got to see my urine in a jar, and I'm like, whoa, like somebody was shining a red light on it. I started singing Roxanne. Yeah. Yeah, it was pretty bad. But anyway, so then I went back to China and back to the school where I was continuing my internship, and I went to the ultrasound department, and we did an ultrasound of my gallbladder, and there was a little polyp, and it's kind of like a little cherry stalk looking thing, little polyp, but I didn't do any. I don't. I'm probably still there. I didn't ever do anything to it. I don't know. So I didn't ever have that problem again. I didn't ever eat that much pig fat anymore either. So I think it's fine. Good. Yeah, I think that about covers it. So keep the didang tang in mind. If it ever comes up, if there still is stasis after using Tao Hatsenchi Tang, but the Tao Hatsenchi Tang is too much flushing the didang tang. Like yesterday when I talked about the rhabdomyolysis patient with the kidney failure, we had him on Tao Hatsenchi Tang for a number of days, but then the nurses started complaining. They're like, we have to wipe him multiple times a day and stuff, and we're like, oh my God. Look at his urine output is increasing so nicely. Why are you complaining? But the nurses don't really care. They just don't want to deal with it. So Tao Hatsenchi Tang, we switched him to Didang Tang. And if you're doing Didang Tang with the processed Da Huang and the boiled Da Huang, and you're not using just the purgative Da Huang, it's actually not bad. The Didang Tang rarely gives you the loose stool. If it's boiled long enough and well, it shouldn't give you loose stool. So that's another option where if a patient has Tao Hatsenchi Tang, right, but it's just after a few days you can't stay on the Mangxiao, you can switch to Didang Tang for a number of days, and after that you follow up with Zhibai Pitang. So Didang Tang's follow-up is also Zhibai Pitang, same formula. They both are followed up by the same formula. Good. Yeah, that's pretty good. Any questions about this? All right then, cool. Let's do something else. Alrighty. Allergies? Yeah? Allergies. Well, we've got respiratory, we've got digestive, we've got skin, right? There's a few aspects there. Right. Let's start with the respiratory allergies. My my take on it is that um, if an allergy uh, is if a respiratory allergy is because there's a certain pollen or grass or something like that in the air, that grass or that pollen or that whatever certain something is in the air at this given moment because of this given season, right? It's kind of like a pathogen, right? If pathogen X only occurs in season X, then the treatment for season X also treats pathogen X. So it's kind of the same thing. If allergen X occurs in season X, then the treatment that often goes with this season actually is also the treatment that goes with this for this allergen, right? So I've never actually used other formulas or special formulas for allergies. I just used whatever formula is necessary based on what chi of the weather is affecting the patient. It's kind of the same thing. So a lot of the allergies, they occur in springtime, right? A lot of the allergies. And now, of course, as I've been traveling for all these years, I mean, I've always lived a very sheltered life in the sense that I always lived in kind of like long periods in like just one temperature, like one climate area. And so I never really seen too much changes. So now that I've been traveling more for seminars, like either Australia or the South or whatever, I realize, oh, actually, while in Oregon winter has already started, in Louisiana the leaves are just starting to fall off the trees. You know what I mean? It's like fall is in full swing. So it's a little different, like because the amount of warmth and the amount of temperatures, and so there's a little bit different. But still, I think in general, you can just kind of, as a general rule, say that if an allergy is more springtime, and springtime is more ruled by Shaoyang, then the Shaoyang formula is going to be very good for that type of allergy, right? If a certain allergy, and especially I think the two intermediate seasons of spring, so if you have like the four seasons, right? Let's say the four seasons, so spring and autumn, right? Spring and autumn, I think there's a lot of Shaoyang. There's going to be a lot of Shaoyang because it's the in-between. It's in between cold and hot, and this one is in between hot and cold, right? So I think from a very simplified point of view, springtime, I'm going to write spring, otherwise it looks like spleen. Springtime and autumn time have a lot of Shaoyang. There's a lot of Shaoyang, need for Shaoyang formulas. Shaoyang formulas in the larger sense possible, because some people need to be harmonized not with a Chaihu, like Shao Caihu Tang. Some people need to be harmonized with like a Bancha Xie Tang. It's still a harmonizing formula, right? So I would say that when people have springtime allergies and it irritates their eyes, it kind of makes their eyes burn and water, and it irritates their throat, and it gives them a dry throat or a sore throat, right? Or headaches or whatever stuff like that, most likely I'll start off with a Sha Cai Hu Tang kind of base structure, right? Sha Cai Hu Tang base structure, right? And then depending on whether they have more Yang Ming symptoms, or more Taiyang symptoms, or more Yang Ming symptoms on top of that, then I'll just build on top of that, right? The fact that the respiratory system is involved, I will always take Ren Shen Da Zao out, put Ganjiang Wu Wei Zi in. Even if they're not coughing, I still put Ganjiang Wu Wei Zi in. Because even if they're not coughing, I still put Ganjiang Wu Wei Zi in, because it's a tonification for the lungs, right? So I'm strengthening the lungs. So I take Ren Shen Da Zao out because it's too much damp, Ganjiang Wu Wei Zi in. The reason why a person is susceptible to allergies, I think I don't know if I'm going to be able to summarize it. There's two reasons in my opinion. One is that a person either A has damp. If you have damp, which means your mucosa, your tayin, is too damp, then you have too much moisture to which the particles can stick, right? Our mucosa have to be damp, right? If our mucosa weren't damp, then our chi layer, the air, would be able to touch the blood layer, and the blood would dry out. So that's not good, right? If you have 100 vessels in the lungs, or more than that, but the 100 vessels in the lungs, then you have to have a slimy moisture coat around those vessels, because otherwise they would dry out because they would have direct exposure to air. That's not good. So you have to have mucous membranes. But if those mucous membranes are too moist, they're going to be too sticky. And then there's going to be too gluey, and then too many particles are going to stick into it. Particles only of this size, for example, I mean, this is, of course, under a microscope. Particle of this size should stick, but a particle of this size should not stick, right? So if your mucosa are at the perfect level of moisture, right, then only particles of the size where the body's like, okay, that's bad stuff. I'm gonna let the phlegm grab it, and then let the moisture grab it, turn it into phlegm, and then we'll spit it out or cough it out or something like that, right? But then small particles shouldn't stick, right? But if you're too damp, then also small particles will start sticking, right? To the point where minuscule particles like paint smell, or glue smell, or perfume smell, those particles are tiny. It's not like the guys who are sandblasting the parking lot right now. You see the dust. You're like, oh, phew, particles. That's a lot of particles, right? But if I put some cologne on and I walk into the room, you don't see those particles. Those are tiny particles, but some people will be allergic to it. Why? Because their mucosa, for reason number one, their mucosa are grabbing onto too many particles because they're too sticky. That's reason number one. This gets influenced by your diet, gets influenced by all kinds of things, right? So basically, this relates to the fact that your tayin, right? Your tayin is not able to truly transport and transform. And it's exactly the same thing in the digestive system. Food goes in, right? And tayin should be able to transport and transform, right? Some of the stuff should just go through, get eliminated, get dumped, but some stuff, they can't dump it, and it stays behind for too long, and it irritates your system, causes turbidity, etc., etc. So that's the same principle, right? So one is that you're going to have to work on tayin. And often, to work on tayin, you can work on tayin directly. That's more ginger treatment, right? But very often, to build tayin, you have to take it one step further and build the mother of tayin, which is the fire element. So actually, you end up using fudzu a lot. Right? That's number one. Number two, why people get too many particles is because they are actually too dry. And the too dry patient is what we call blood deficiency patient. So the damp, some people are too damp, right? And some people are too dry. And the too dry means that the patient has blood deficiency, right? And the blood deficiency patient, they don't have enough moisture in the mucosa because, of course, the moisture in the mucosa sweats out from the blood, blah, 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 right? So they're too dry, their blood layer is too sensitive, it too easily gets affected, and then whatever particles or stuff like that, they just can't, the body can't get them out of the body. It irritates the body, it causes flaring of the heat, etc., etc. They're too dry. The dry patients have a lot more problems with skin allergies. Right? The damp patients are more digestive and respiratory. Right? So let's put it this way: the damp patients are more digestive, right? And then the dry patients are more skin, and then there's like a little bit of group of people who are in between. Right? So some people also with dry, they also have respiratory issues, right? And so. The dry patient, for example, skin allergies, they get rashes, they get itching, they get discoloration, right? Hives, then it goes away again and stuff like that, right? Their blood is weak. They can't. When the blood is weak, you don't have sweat. When you don't have sweat, your body can't cool itself off by opening the pores, right? So the lungs have a hard time opening. It's kind of like in autumn time. In autumn time, autumn is the season of dryness, right? But what's a good? Name me a formula that is often used in autumn, right? What is the formulas that we kind of normally associate with autumn? Qinglongtang. Excellent. Qinglongtang. So, my question is then, when you're looking at Xiao Qinglongtang, do people have a wet cough or a dry cough? A wet cough. But I thought autumn was dryness. So why is Qinglongtang an autumn formula? We actually had a nice little discussion on the forum on that one once.
It's a fluid imbalance where the fluids are shunted the wrong way.
Yeah. So basically, it's in the wrong place. If all the dryness is on the outside, bearing down on you, where are your fluids going to get pushed towards? Towards the inside, right? So the fluids want to come out and moisten the skin. But they can't because there's too much dryness on the outside, preventing the fluids from coming out and moistening the skin. So where's the fluids? They're all trapped on the inside. So the same thing. A blood deficient patient is also, so in autumn it's very difficult to sweat because the air is so dry. It's very difficult to sweat, right? So that's why you need to use ma huang in autumn, which is the strongest diaphoretic. That's why we call that the blue-green dragon, because it's the main herb that will bring the rain. It'll bring the sweat. It will cause moisture to manifest on the skin. And when moisture manifests on the skin, there will be less moisture on the interior. Right? So it's a redistribution of the moisture. So that's for excess dryness. Now think about deficiency dryness. It's the same principle. A patient who is blood deficient also can't sweat. So it's the same principle. They also can't sweat. So their lungs also, the skin is also dry. The mucosa in the skin, are dry, and they also can't take anything on their skin, right? Contact with this or that chemical, boom, right away. That there's not enough oils in the skin to protect them from whatever environmental chemicals exist, both natural or unnatural, right? So it's a similar pattern. So that's more the contact dermatitis type of patient, right, or skin allergy type of patient, versus these are more the internal cases, right? So, but first, these are things to remember. So basically, you most commonly start off with a chai hutang, right? A chai hutang. So damp and dry. Yeah, let me erase this here. So strategy-wise, most commonly you'll treat with a chai hutang, right? So for example, a xiao cai hutang, right? Minus 人参大枣 plus 干姜五味子, right? That's a nice little start. Then, if your nose is very snotty, if you have phlegm in the back of your throat, depending if this phlegm is more wet, then you have a potential of adding lingui zhugantang. Right? If there's more wet phlegm, wet moisture, lingui zhugantang. If you have more the dryness, the nose is stuffy but very dry, and there's more snot that's more yellow and things like that, postnasal drip that irritates the back of the throat, it's kind of raw and scratchy, then you have more Guggen indications. Guggen or Guggen Gualo or Guggen Guggen Gualo is probably fine. Well, yeah, because we got Shatzak, we already have Bansha, right? It's more thicker, it's postnasal drip, it's irritating the throat, those kinds of things, right? Remember, when your throat itches or is irritated when you breathe in, we call that wind phlegm. So one of the formulas that we use for wind phlegm is Xiao Shen Xiong Tang, right? So that's another possibility, is Xiao Shen Xiong Tang. Xiao Shen Xiong Tang, right? Plus Xiao Shen Xiong Tang. So then you have the formula called Chai Shen Tang, right? What the Japanese call Chai Shen Tang, right? Xiao Cai Hu Tang and Xiao Shen Xiong Tang. But don't do as the Japanese do, right? what they just throw those two together. I don't want you to do that. I want you to use, if you do chai xian tang, you have to have ganjiang in there. I want huangnian ganjiang combo. I don't want no huangnian shengjiang combo. Huangnian ganjiang combo. You got to protect the spleen because that's where all the damp is coming from. So if you're shooting the spleen with the huanglian and not protecting it properly, then you'll have need for more warm herbs down the line, right? You've basically shot yourself in the foot, right? So if you're doing Shao Xian Xiong combo, with the Chai Hu Shao Xian Xiong combo, make sure you have ganjiang in your formula, right? Some people don't even need the Shao Cai Hu Tang. All they have is just a lot of sinus congestion, a lot of phlegm in the throat, those kinds of symptoms, and then they actually just need Ban Cha Xie Xin Tang. Right? Ban Cha Xie Xin Tang. They don't need Chai Hu, right? So then Ban Cha Xie Xin Tang minus Ren Shen, Da Zao, plus Wu Wei Zi, right? Plus Guggen if the nose gets very stuffy or if it gives you headache, if it gives you eye pain, heat in the eyes, irritation in the eyes, right? Those are all possible modifications. Again, plus Gualo if necessary, right? That kind of stuff. That's kind of very much kind of stays the same. So that's the other option. Either you harmonize with the Shao Cai Hu or you harmonize with the Ban Cha Xie Xin. Right? Those are kind of like the main ways to harmonize the respiratory allergies, the itchy eyes. Especially when the eyes get painful and dry and itchy, the Guggen is very important. If the eyes become really a problem, Juhua is allowed, right? Our lineage does allow for the use of Juhua, right? So if the eyes get really a problem, right? Now, that's most commonly what you see. Now, I should probably take one step back and say, okay, aren't there any stages before that? And there are stages before that. Before a person has Shaoyang, they have Taiyang or Yangming, right? So, but I'm just saying that this is most common because the patient tends to come into the clinic only when they're at this stage. They don't really tend to come in at the Taiyang Yangming stage, right? But if you want to be, for all intents and purposes, if you want to be complete and encompassing, then actually you have to be aware that Guggen Tang is actually the stage that can precede this. Right? Guggen Tang is the stage that can precede this. Shao Qinglong Tang is the stage that can precede this. Shao Qinglong Tang plus Guggen, right? That's another option, depending on what we're looking at, right? In your climate here in Southern California, I think you're much more likely to see Guggen Tangs than Shao Qinglong Tangs. It's not as cold, not as damp. In Portland, you can see maybe a bit more Shao Qinglong Tang stuff, right? And then, especially the Guggen Tang, because Guggen Tang is our numero uno for ophthalmology, our first formula for eye conditions, for eye problems, right? So dryness of the eyes, pain of the eyes, orbital pain, frontal headaches, floaters in the eyes, Guggen Tang plus Juhua. Right? That's our number one formula for that. Our number two formula for eyes, which actually is also very good for sinus issues, for allergies, for respiratory problems, is Guggen Qinlian Tang. But that's when the Guggen Tang phase where there still was cold is gone and it's now only manifesting with heat. So Guggen Qinlian Tang, Guggen Huanglian Tang also has to be remembered. Same thing. Guggen Qinlian Tang plus Juhua, number two formula for eyes. A lot more heat, a lot more severe stuff, burning of the eyes, floaters in the eyes, orbital pain, frontal headaches, right? Plus, what does Guggen Qinlian Tang, does Guggen Qinlian Tang do anything for the respiratory system? Per the original line, it treats panting. It's actually a formula that treats asthmatic breathing. Guggen Qinlian Tang often overlooked as a formula that is able to settle an asthma attack also. So that's why it's also a good one for respiratory stuff. Right? When I'm using Ban Cha Xie Xin, Shao Cai Hu, those kind of formulas, obviously lots of emphasis on the nose, ear, throat kind of stuff, right? Not so much an allergy where the person starts to wheeze and has difficulty breathing, right? An allergy that kind of, let's say a person walks into the room and there's a dog in the room and this person is allergic to dogs and gets an asthma attack because of that, because of the dander, that most commonly is going to require a Ma Huang Shi Gao formula, right? And the main one for that is Yue Bi Tang, right? Yue Bi Jia Ban Xia Tang or Yue Bi Tang. So seasonal allergies, it's a little bit more this, right? Seasonal allergies. Here also, stuffy nose, maybe a little bit runny, but it feels stuffy, but there is a little bit of water still dripping out. Tang. If the eyes are involved, plus Juhua. If the nose is very stuffy and the phlegm is thick and yellow and it's all congested with maybe pressure in the eyes and things like that, Tang plus Juhua, right? Those are all things. If you're going to talk about respiratory allergies due to kind of like environmental stuff, right? Person walks into a room, there's a dog in the room, or there was cigarette smoke around or something like that, and the person starts to have difficulty breathing, then normally you deal with Yue Bi Jia Ban Xia Tang, right? Ma Huang Shi Gao combination, huh? Yue Bi Jia Ban Xia Tang. Yue Bi Jia Ban Xia Tang also is for people who get so that's for asthma attack, right? But if people get, due to their allergies, they get like swelling in the face or hives on the body, it's also Yue Bi Tang, right? So Yue Bi Tang also treats wind water, right? So swelling in the face, hives on the skin, right? If they get like the typical discoloration, blotching, wheals, those kind of things, it's also Yue Bi Tang. Right. This is just this should settle it in just a few days. Yeah, this is very short.
What about someone who has the chronic hives still?
I think that's more blood deficiency. Because Yue Bi Tang is the skin can't breathe. The skin can't breathe because the skin is acutely closed, right? Skin can't breathe, skin is acutely closed, the skin heats up and it cannot cool itself off. So what happens, the heat rushes to the face, right? So they get red in the face, skin stays closed, that's typical Yue Bi Tang in excess. But in deficiency, people who have blood deficiency, same thing. They also can't cool themselves off because now they don't have blood to sweat with. So then their body surface is so dry that they also can't sweat, therefore they can't cool off, and they also get heat rushing to the face. So the presentation is similar, but then it's blood deficiency. That's going to be a Dangui pattern. Right.
What about any like non-frustration time involvement in itchy hives?
Not in hives, to my knowledge. The Gansa Sheshintang, because there's more heat in the flesh, it's already water layer problem, so there's going to be changes in the actual tissue, the actual skin tissue. Yeah. Not so much just blotching and discoloration and hives. More blood deficiency? Yeah, just blood deficiency. The patient doesn't have, this one is more excess, so the person has water to sweat with, but the skin is closed, can't sweat. So then they heat up, overheat. The blood deficient, the Dangui patient, doesn't have enough sweat because their blood is so dry, and so they also can't cool themselves off, so they also overheat easily, and they get discoloration or rashes on the skin and itching on the skin and things like that. So yeah, and then so those are kind of like all how to manage the acute happenings of the allergies. And then underneath you had to work on either the damp or on the dryness, right? So then underneath, for the chronic treatment, if you need to work on the damp, you're basically, if the mucosa have too much moisture in it and therefore are trapping too much impurities, then basically that's what we will call a phlegm room, a tanyin, right? Phlegm room. And then if you're treating phlegm room, The standard formula is Lingui Jugantang, but that's, in my opinion, a bit too mild, right? Most patients, you'll actually use Zhenwutang, right? So to slowly start warming them up and get rid of their damp so that they can start to metabolize their damp and dry out their mucosa, you go towards Zhenwutang. So then Zhenwutang, if it's respiratory plus the cough modification, right, plus Ganjiang, Shishin, Wuweizi, right? That's pretty standard. Of course, if it's dietary allergies, maybe they needed some, I'd say, bancha shishintang and stuff like that for the damp in the stomach and heat in the system and things like that. Ultimately, to get the damp out, you also should be using something like a Zhenwutang. If, for example, let's say lactose intolerance, right? If the dietary allergy, the lactose intolerance gives them abdominal pain and diarrhea, then you do maybe, for example, the Zhenwutang diarrhea modification, Zhenwutang minus Baishao plus Ganjiang, right? That's the diarrhea modification for Zhenwutang, right? So, but Zhenwutang is a really good formula to kind of fix long-term dampness. One thing that I forgot to mention in the previous formulas, like the Xiao Caihu or the Caihu Guizhi, Ganjiang, Bancha Sheshin, those kind of formulas, is that if there is a lot of panting and wheezing and stuff like that, you can also incorporate Hopo Xingren, right? I forgot to mention previously that you can also incorporate Hopo Xingren for those patients, right? Hopo Xingren is used when the surface is open, right? Ma Huang Shigao or Ma Huang Xingren is used when the surface is closed, right? Hopo Xingren is used when the surface is open, right? So that's when you would incorporate those. And you can kind of just symptomatically throw that in those formulas, right? So that's, and actually I do this a lot when I'm treating patients with asthma. For example, Zhenwutang, Ganjiang, Shishin, Wuweizi, plus Hopo Xingren. That's also fine. That's also fine. You can totally incorporate that. Asthma is still something that eludes me a little bit because I've gotten fairly good at managing it. Just, not without too much trouble, following these guidelines, keeping a person from having too much breathing problems and making their breathing better. And, I have this patient who, she's a singer in a choir. And so for her measure is always how long she can hold her notes in the choir. The gospel and things like that, and church and things like temple and things like that. And so that's always her measure. So she's doing really good. But I don't dare to say that I'm curing her asthma. You know what I mean? That's still something that eludes me. Like, I'm not really sure what else I would need to do to actually cure the asthma. I've read up on things, and some doctors say there's a blood stasis component, because of the 100 vessels in the lung and stuff like that. But I don't really, I've played with those methods a little bit, but I don't really see it improve, even with a bit of blood movement in there. I don't really see much change. So I'm not really sure exactly what I would have to do extra to cure the asthma. Maybe it is truly just a matter of time, right? I feel like asthma is almost like you could almost chalk it up to like an autoimmune kind of thing, right? It's the body's not being ruled in the proper way. The lungs are not being ruled properly by the emperor, by the fire element. So just working with this kind of strengthening of the yang, of the warmth in the lungs and stuff like that, maybe it just requires a long period of time, and maybe they can snap out of their actual asthma diagnosis. But I don't think I've actually accomplished that yet on a patient. But managing it with herbs so that they don't need inhalers and stuff like that, no problem.
Well, because it's so common to have asthma after a severe viral attack, that's a lingering property.
Right, yeah. Yeah, so it always precedes. It's always preceded by harmonizing, and then transforming and warming and things like that. Yeah, I just don't know how long it takes for the body to snap out of that. But it might be the same like with any autoimmune disease, where it might take years for the body to snap out of that, right? So, but at least in the meantime, their symptoms are very well under control, right? And so that's fine. Yeah, or other steroid inhalers and things like that. Yeah, I think. Yeah, I always, you've heard me say this, like Yue Bancha, like I said, that's our herbal equivalent of a steroid inhaler. But you have to do it in bulk. It doesn't do it in granules because the Shigao granules don't work that well, right? So you really have to do it in bulk. But in bulk, it's really good formula. It's a very good formula. It's really settles the asthmatic breathing. So Yuebija Bancha for panting and wheezing. Of course, if you know Yuebija Bancha, you know Ma Xing Shigan, you know Xiao Qing Long Tang, minus Ma Huang plus Xingren. I mean, there's a lot of formulas that treat panting and wheezing. So all of them are candidates to settle a patient's panting and wheezing. Right, and then the skin, basically, people who has very sensitive skin. You have to work with a dangui. You have to use a dangui treatment. I mean, there is just no other way around it. You just have to get to the point where you can get them on a dangui formula. And so the main formula, I would say, is dangui sinitang. That's our main formula, right? To not only nourish the blood, but also make sure that the blood goes to the skin, so you can float it into the skin. Dangui formula, dangui sini. Another one that's good, which we shouldn't forget, is shumingtang, right? I, however, have not really had the opportunity to have a whole lot of cases on Shumingtang. But Shumingtang is actually Ma Huang Shigao and Dangui combo. So keep that one in mind. But like I said, I'm just waiting for an opportunity, right? It's for Feng Fei, right? And Feng Fei can be translated as loss of use of limbs due to wind strikes. But it can also be translated feizi in Chinese. It's actually kind of like a heat rash, like how babies get heat rashes in summer, right? They get the little prickly rashing, like the little red dots. That's also what we call feizi. So this is a formula that also fixes skin conditions, skin things, right? And actually, the Dr. Zheng Guanglu, who was also a disciple of Tian, used Shumingtang, which is a Ma Huang formula, also very effectively for hypertension. But I haven't really gotten to figure out the mechanism yet. His daughter told me that, and she just knows of it. She couldn't really explain it to me. But she said that her father would always say that by opening the pores, you also release the system's pressure. It's kind of like a pressure cooker, right? Like by opening the pores, the pressure also can be released. So this is using Shumingtang. The reason why is that because Shumingtang treats sequela of stroke, right? Because loss of limbs due to stroke, loss of use of the limbs due to stroke. So you can not only treat the stroke, you can actually also prevent the stroke if you use it to lower blood pressure, right? So this is one of the Ma Huang formulas that they also use for hypertension. The other Ma Huang formula they use for hypertension is Ma Huang Fuzi Shishintang, right? But I also haven't had a chance yet. I mean, I've known about this now for so many years, using Ma Huang Fuzi Shishintang for hypertension, but I also still have not yet have found an opportunity to really use it. Most of the time when I'm using Fuzi formulas for hypertension, I'm working with Zhenwutang, right? This is a Ma Huang Fuzi Shishintang, so I'm a little bit like, waiting for a chance to use it. The difficulty is that Ma Huang Fuzi Shishintang, just like in Zhenwutang, left-hand pulses are deep, weak, right? And then maybe wiry or tight on the left hand, right? Especially left-hand chirk can be a bit wiry or tight. And then the right hand, in Zhenwutang also, the right hand chun position can get tight because of the taiyin aspect of a Zhenwutang. But when you have a right-hand chun position that's tight, that could also be a Ma Huang. That could also be a Ma Huang. It's considered a Ma Huang pulse. So like crap, like when is it which one? So then the thing that I kind of use to differentiate the two is that if the right hand first also rolls up, then it's Fuling, and we don't do Fuling Ma Huang combo, so then I go with Zhenwutang. If it's just tight on the right chun without any type of rolling up, then I would go Ma Huang Fuzi Shishin. That's the only way that I use to differentiate the two. But the pulse between those two can be very, very similar. It's yang deficiency with an immobilization of your water. But in Zhenwutang, it's still in water form. In Mahanfu the Shishintang, it's iced over. Right? So that would be the difference. So if you are looking at a hypertension and you're using Zhenwutang, right? Then and you're certain that it's a yang deficiency, but it's just not responding, you could always try going to a Mahanfu the Shishintang. But Dr. Tian was so good, he would just go straight to Mahanfu the Shishintang on certain patients, you know. The other thing is also, like, if you understand that it's stagnant water, and then we'd use Zhenwutang plus Muli, in case it is iced over water, the fact that you're adding salt can also reliquefy and melt your ice, right? Because you're using the Muli in the mixture. So also there, I think Dr. Tian, it has an extra level of genius in there, because you can melt ice with temperature, but you also can melt ice by sprinkling some salt on it. So if it was a Mahanfu the Shishintang, but you use the Zhenwutang plus Muli, you actually might already have some results. Which of course makes it harder to understand when it is Mahanfu the Shishintang, which is the dilemma that I have been in for the last 5-6 years, right? So kind of trying to figure out the differentiation between the two. Anyway, Mahanfu the Shishintang is also used for rhinitis, right? For chronic rhinitis. So it's just a old lingering cold in Taiyin with no yang in Shaoyin, right? So that is possible that you can also use that formula for those kind of chronic rhinitis cases. Mahanfu the Shishintang. But it's not something that I commonly use for asthma or commonly use for allergies per se. But know that it is a possible candidate for a rhinitis cases. And no yang in Shaoyin. So Shumintang is a Dangui formula. Other Dangui formulas for the skin, I mean, Dangui Sinitang is fantastic for the skin, right? You have a Guijitang structure inside, and then you have Dangui on top of that. So you can bring the new blood into the skin to nourish the skin. It increases the quality of the skin. It gives more blood supply to the skin. If you have easily dry skin, like winter is coming up, people's skin is getting more dry, right? That's all Dangui Sinitang. Especially if people have chapping of the skin in winter, it's all Dangui Sinitang, right? If the blood is less cold, it's just deficient but less cold, then it's Dangui Jenzongtang, right? And of course, when you're treating skin allergies that manifests with rashing on the skin, then of course the skin herbs that we use in our system, the Jinyinhua, Xuanshen, and Tufulin, can also be used on top of a Dangui Sini, on top of a Dangui Jenzong type of formula, right? Yeah. So Shumintang and yeah, I think that about covers it. I mean, as far as different types of allergies. As far as dietary allergies, personally, I would say that my favorite, I mean, ultimately you have to go to a Fudzu formula. I'll say something about that after the break, dietary allergy. Just a few more things on that topic after the break.